All right, good morning. Can you see the mug? Says, see the good. It's one of my favorite mugs. I think it's such a beautiful way to start the day and frame things. Find gratitude, find joy, find the positive, even in the midst of the difficulty, whatever you're facing during the day. So I thought it was an appropriate mug for this week. That was the attitude that I was trying to take to last week, so I had to cancel the live session last week. I got ill, a little bit ill, so that was not too nice, but that is how it goes sometimes, isn't it? It's a little frustrating, I will say. I think, as a doctor, as someone working in healthcare, to not even really understand, like, why is it that some people get sick sometimes and other times, people don't. Like, to really understand it, it's always a little bit of a mystery. But it is part of life, and so I give you some reflections this week on health, illness, fasting, intersection. Try to give you some good reflection on that. Last week, I was speaking. I got to give a fasting talk at a nursing convention, which was quite nice. I got to interact with so many people. Very, very positive environment to be able to dive into a topic that I obviously like in a medical context like that. Talk about my research. So that was great, and finished up the talk, and I think I talked for about an hour and 15 minutes, and then took questions for half an hour into lunch. And then, my voice was kind of scratchy by the end of it. And I was like, I just did too much talking, but by the time I drove home, then I wasn't feeling too well. Oh, before I forget it, the previous week we did the coffee session, which I really loved. Pat was bringing up mushroom coffee. So I did dive in and try it. I have a few thoughts. I think it's not really for me. That was my thought. I just like regular coffee so much, so I stick with a regular coffee. But I was reading through it, studying it. I think it's a perfectly healthy thing, and I can see why someone would like it. The one I had for a cup said about 15 calories, and I mean, I think that's fine. I've talked about this in other sessions. If just 10 or 15 calories in a coffee, does it matter? I say, well, it's probably not pure fasting, but maybe it doesn't matter. And unless it does, and then it's like you can try to figure that out on your own. If you're using a product like that, this a healthy thing, a little calories, you say it's not pure fasting, but if you enjoy the space and you like it and you're accomplishing everything you want, that's the type of thing I would never care about. I always say, don't let the perfect be the enemy of the good, for sure. And if something is good enough, maybe just, it's good enough. So that was my thought on that. See the good, seeing the good in the illness. That's what I was trying to do over the week. That's kind of like that theme I was exploring a couple months ago, illness as teacher. So I was just thinking for myself here, okay, what can I learn now from this? What can I take away from this unfortunate development? The first thought that I came to was like, well, illness is a space, kind of forces you to slow down, somewhat of an unpleasant space, and so it's like makes you focus to some degree on, say, like, what are the things that are really important here, actually? Like, if everything else has to stop, uh, what are the important things? And then it really centers in, on health. Like, a lot of times we take health for granted. So easy to do. When everything's going well and we're just floating along and we got so much to do, say we take health for granted. It's not till the health takes a little break, we have a hiatus from health. All of a sudden, the health's absence, it just becomes the top priority, and it kind of helps to center and realize like health kind of always is the top priority, but then so often we can skate by without thinking of it that way. But then you get ill, you're not feeling well. It's like you think even just a simple cold, a simple cold is like a great misery, really. You have a headache and sore throat and hard to talk and coughing. I mean, it's all miserable. And so I was reading some things while I was sitting there on the couch, not feeling well. I came across a concept that was like, if someone offered you some astronomical wealth, like $1 billion, but the trade-off was you had to have a cold for the rest of your life, and like every day is going to be headaches and sneezing and whatever, like, would you trade for it? And like, pretty much everybody would say no. I mean, I would certainly say no. Like, you want to be like miserable? Like, a whole point of like having money would hopefully, be to try to alleviate some amount of the misery of life and find joy and happiness. And how can you really do that if you are feeling, dreadfully ill? And so to me, that was a very centering thought, to realize like health so much more important than money. Health is just, like this thought I was having, the centering effect. What are the things that really matter? Our family, our health, our relationships. So that's a way to see the good in an illness, to say, oh, is this really tangibly in my body, in my experience, helping me to feel the importance of these things? And then as you're coming out of it, to say, well, how can I take that perspective and use it to push forward in health, to make that opposite space, or out of illness into health, feeling well, and then use it as a springboard to kind of power that forward. That's what I've been trying to do. Sometimes I think we can bring illness on ourselves. And then sometimes I think also, illness just happens to us. Like sometimes, right, we know we do things that will lead to us getting sick, right? So you stay out too late, drank too much, like whatever the thing was, and like you pay for it, right? But sometimes I think, some virus comes through, like whatever. Sometimes I don't really know that we can do anything about it. And so that was another thing I was thinking about this week. Like, you don't want to either guilt trip yourself or someone else to say, like, every bad thing that happens to you is like some moral failing. Like, that's not very nice. And I don't even think it's true. And so I was thinking about that this week. I was like, well, like if I hadn't done this or that, or was I stressed out? I think there can be some value in that as we're trying to move toward health, to make sure we're taking the best care of ourselves that we can. Because I think it is complex. Like, we have some agency in keeping ourselves well. And then we have some amount to just deal with what comes along. But as I was kind of transitioning out of that, that there's kind of that moment, you kind of had a cold and you can just feel it switch. It's like, oh, like we're just getting out of it. And then it feels, you can just feel this good health returning, and it is like seeing health as a gift. It just feels like you can really feel it in that moment. Like when you've been feeling well for so long, and then you feel like it's in the background, you're taking it for granted. But on that line where you've been ill and you switch over, then it just feels like such a gift. We're like, oh, feeling good again. So health is a gift every day that we have it. such a beautiful experience. And so to strive after that and make sure that on any day when we're not ill, we kind of dial into that space and think, okay, what are the decisions that I can make today that are supporting good health? And these are the simple, basic things that we always talk about. Making sure that we're getting good sleep, eating the healthiest foods, keeping toxic things out, managing our stress in the best way that we can, coping with it effectively, maybe opening up a fasting space, get that autophagy effect, clearing out the excess. Kadeen is here. Good morning. How are you today? Hope you are doing well. Seeing that health is a gift and then that fasting part of it, that's what I try to dial in on with folks. Fasting to me has two kind of interactions with it. Like, this is what I've been thinking about this week. Okay, can fasting help you stay healthy? Absolutely, it can, and in a couple different ways. Primarily, when I talk about fasting, keeping someone healthy, this is primarily from a concept or a standpoint of preventing chronic disease. So things like diabetes and metabolic syndrome, then it's kind of unequivocally in my mind, like, yes, a fasting space is going to help reset the metabolism, clear out the dysfunctional and stuck parts of the metabolic system, and help that return to balance. The thing I was thinking about this week, since I had a cold, I was like, how much does a fasting practice, just help the immune system in general, keep you from getting sick? I'm not actually aware of tons of direct studies on this. I've never, read a study on it, for example. It's very clear in literature, though. For example, elevated blood sugar is impairing to the metabolism. Lots of studies in the hospital on improved health outcomes from infectious disease and other things when blood sugar is well controlled. You can kind of extrapolate, I think, from a lot of that data. Like, well, clearly, as the system is functioning more optimally, it at least makes logical sense that it's going to keep us in a healthier state. But it's not like a force field. I mean, I do plenty of fasting. And of course, here I'm just telling you I got sick last week. So there's kind of a balance there. So yes, definitely for chronic disease, and especially in the long term. In the short term, like, this is a little grayer area. And then the other side that I was thinking of it on is like, okay, can fasting help keep you in a healthy state? Like, yes, with an asterisk. And then, like, can it help you get back out of it? And I think I've reflected on this on the channel before too, about so many times when we're ill, if someone is in the hospital, someone is very sick, our appetite naturally goes away, and people often equate that as just part of the negative. Be like, oh, I was so sick, I couldn't eat. Like, the fasting space, though, I think is a very intentional healing space in the body. The body uses a fasting space to actually free up resources for the immune system and the body to fight off infection and deal with illness. And so I think, and this is another area that, we have $1 trillion health system, but not any money to dive into some of these very interesting, simple, basic, things to delineate exactly how it is that the body is doing what it does and in the fasting state. But absolutely. I think I put a post on the channel over last week when I had to cancel the session. I took a little picture of my fasting dinner. You can check that out on the community tab. I don't think I loaded it up here. There's this Hippocrates quote, to eat when you're sick is to feed your illness. I was kind of reflecting on that. And as a general rule, I do endorse that. I do believe that, especially in the short term. As if someone is very, very seriously ill, of course, uh, all kinds of bad things can happen to people if people don't have good nutrition and things. But I'm talking about on the shorter end of the spectrum. Taking a space and not, especially if someone has a bacterial infection, bacteria thrive on sugar, and to be able to dial that down a while, starve the thing out. I mean, I definitely think there's real physiology in there with that. And it is also definitely clear that when we're eating, a lot of our immune system is heading into the GI tract to support the digestive process. Everything that we eat isn't sterile, right? And so actually everything, if you realize it's coming into the body, it has to be sterilized. And so if you're trying to free up resources for the immune system, definitely there's real physiology there that you're going to free up a lot of resources from the immune system to fight an illness and deal with what you need in the body. So that's been my experience, that the actual part of the appetite going away is an intentional part of the system, and that we can voluntarily lean into it if we're feeling inclined to do it. I think there's pressure in our society and culture because it's a consumption culture, and we have all these assumptions that you have to eat all the time to be healthy. And so what happens a lot of times, people are sick, the appetite is going away, and people get food pushed on them, even if they're not hungry. And people say, no, 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 you have to eat in order to get your strength back. I think there's definitely a thoughtful space, though, to listen to the body and to say, like, actually, fasting space, very healthy space in the body, is a tool that the body can use to restore health and bring health. And I don't think we should be so aggressive, especially in the short term, to override the body's natural inclination. If someone's ill and they're not feeling that hungry, that's a space where I say stay hydrated. Obviously, don't want someone getting dehydrated, but I think it's definitely okay to embrace a fasting space, and health can come from that. That was my experience. I was not that hungry when I was ill. I said, well, here's a great opportunity. I'm going to dial in this autophagy effect, and I'm going to just embrace this open space. And it felt good, and it did help me, and it felt better. And then as I felt better, my experience, I basically fasted for 2 days while I was not feeling well. And then, and then it kind of flipped over, and I felt great. And then the first thing I ate, when I came out of that, my appetite is coming back. I'm feeling my energy back. I'm feeling better. And I ate this beautiful orange, and I peeled that. And that is kind of this same juxtaposition of, okay, from health or from illness to health, that transition, realize, oh, health is such a gift, to see it return and to feel it return and feel the gratitude for it. And then in the body, a fasting space kind of has that same reflection, because we have to eat. Every time I'm saying fasting is just the other side of the coin of healthy eating. And so we always need that. We always need good nutrition. We need healthy food coming in, and we need a break. But so my experience to dial into that space, okay, an orange has never tasted so good as when you've had a big fasting space, and then you dial it in, and it's like, oh, it is so delicious. And then you find just this new level of gratitude for it. And I just really appreciated that. New to fasting, I'm glad this can be a resource. Thank you for that. Can I recommend a book for the new faster? Yes, I can, which is The Complete Guide to Fasting by Dr. Jason Fung. Have you come across Dr. Fung before? He's a thoughtful guy, kidney specialist. He was one of the first people I ever found that was talking about fasting, and he has a real nice book, The Complete Guide to Fasting. I think I have it upstairs. That's kind of my go-to book when somebody is just coming in and starting out, because it's pretty simple. It goes into just basic patterns, basic stuff, like how do you get through a space and kind of fasting aids, like all the basic things, favorite beverage of choice, and using broth and all kinds of things. And I think some thoughtful ways to transition out of fasting. So see if you check that out. When I was at the university, I bought boxes of those books and I would just hand them out to people. So a lot of people have found a lot of benefit from that. See if you find that to be the case, and if you have questions about it as you're reading through it or things, of course, throw them in a comment, and I'd be happy to give you any perspective on it for sure. So I think those are my main thoughts of the day on, illness, health, and then mirroring that experience, fasting to eating. There's kind of a transition in both of these things. Is creating this kind of juxtaposition, this tension where we experience kind of two sides of it. And then in each of these, the thing that I think can be helpful, finding a renewal. Each of these things is kind of a renewing experience, coming back to our normal experience, our normal experience, hopefully, of health, our normal experience of eating with a fresh perspective, renewed gratitude and appreciation for it. I think, the attitude that we take toward whatever we're doing in life, whether it's a health goal or a personal goal of some kind, I think increasingly life is mostly about attitude, like the attitude we take toward it, the perspective we have. The same person, clearly, the same exact experience happens to two different people, one who has a certain attitude and one with a different one. People can experience the same exact thing in such different ways. And so these types of framing, you say, why does one person have the attitude that they do, the perspective that they do? Well, we're shaped by our experiences, right? And so if we want to change our experience, how do you do that? That's not an easy thing to do. So I think these are actually some of the ways that you do it, to look at these balance points, illness, health, and to find that gratitude and that line and that appreciation in the middle of that. I think those types of experience, and then fasting be another one. Normally we're just on autopilot, eating all the time. Okay, so but to separate it out, to have space, no eating and then eating, helps you to find that line and see the gratitude. And I think as you sit in that space and you reflect in that space, that's actually how you change your perspective on it. And so that would be my encouragement for the week. Find those sorts of lines, a fasting space being kind of that edge that's the easy one. No illness, not so unpleasant. I was reading this article. It was a medical journal I found, 1916, Canadian Medical Association. Maybe I have it somewhere around here. I bet I can bring it up. I like reading historical medical literature. So yeah, here I found it. The Canadian Medical Association Journal, August 1916. Fasting, this was a paper called The Treatment of Diabetes Mellitus. Now, in 1916, they didn't know even type 1 versus type 2. They had no medicines. Insulin was years away from being synthesized. Here they say that temporary periods of undernutrition are helpful in the treatment of diabetes will probably be acknowledged by all after these 2 years experience with fasting. They ran a fasting study for 2 years. This was in Toronto. In no other way can one so readily keep the urine free from sugar, and this is the foundation of all diabetic treatment. Isn't that fascinating? Like that we lost a little bit there. And then they go on to say, fasting is never so rigorous as doctors or patients expect. Patients more ready to undergo it than physicians to prescribe it, quite as often a relief to the patient as a discomfort. Headache occurs less frequently than I expected, usually dispelled by a cup of coffee. Yeah. So I just so much enjoyed reading that. But that is kind of the experience. Fasting, not at all, in my view, on the same level as illness. So you want to find a space in your life where you can find a line like that. Much easier to dial in on a fasting space than to have to wait till you're sick and then get better again, hopefully. You never wish that on someone. So maybe that's a space to dial in on for the week. Find that line. The thing about it with fasting, I do like the book that I said, but just realize that the numbers, the numbers are pretty much arbitrary. Most people eating every 12 hours, and so you start pushing that out. It's not like you hit 16 or 18 hours and it's some exact magic thing. There's everything is a spectrum. And you say someone only feels comfortable out to 14 hours. Well, that's no big deal. You opened up another couple hours. It's not about what can someone else do. It's about where is your body at and where is the physiology in your body. And I never want people doing things that are uncomfortable for them. And so you kind of find that edge. Some people's edge going to be, way in a different place. I say you get out to that edge and you say, this is about kind of where I feel like, maybe that's good enough. I always look at these things like a training program. And you say, I kind of feel like calling it here today. And try again, tomorrow. And this is a thing that you can build out over time. So I never want people to feel like, I didn't make it to like this hour or this thing. And then people start feeling bad about themselves. They stay far away from any kind of thinking like that. A fasting practice is just an exploration. It's a personal exploration in the body of understanding how does the body work? How do I train my body to be able to function off of the energy that is within it? We don't train the body to do that. We've totally externalized, always that energy coming in, and to say there's some value to just running the other side of the system for a while. And so if you look at it from that perspective, a personal exploration, an interesting health experience, it is, I like to say, a human experience. It's been part of the human experience. People have found value from this for many, many years. Here we're reading about thoughtful people in 1916, exploring it in a medical context to helping people. And you could go back with that all the way back to Hippocrates thousands of years ago. People have been doing that. So I know my personal vision or perspective is that our culture would greatly benefit from a reincorporation of this practice, in a more thoughtful way, just into the culture and into the medical system. Like if we were to be a culture that embraced the wisdom and functionality of the body, wow, what a difference could it make? I'm not opposed to medicine, for example. I'm an internal medicine physician. I like it. There's great value in medicine, but our culture, it's so either or, like you go back to this paper, 1916, they were like really helping people basically completely for free with fasting. And once people synthesized insulin, that was, drug number one. And that's a miracle, especially for people with type 1 diabetes, a total miracle. But like people lost touch with this practice. And it isn't all, medicine, and it isn't all, fasting and natural things either, There's benefit from both, but we need to regain the balance and find the balance. And the balance has swung so far toward the pharmaceuticals that people have lost touch with this, basic functionality in the body. And that's where I think our society and medicine would really, really benefit. So I think there's a lot of resonance with that within the medical system too. I was saying, I was speaking last week at this nursing conference, and I had such great conversations with so many nurses about it, and they're like, "Yeah, we have really got to find ways to incorporate it." So that is what I am working on. I'd be very happy to hear any thoughts that you all have about it. I'm, of course, exceptionally open to good ideas or thoughts. We have a discussion about it. So appreciate you being here today.